Hello family, hello friends. So guys, once again, thank you so much for subscribing to my channel. Thank you so much for your love, your support. Thank you so much for your encouraging words. This is Dr. T, and once again, welcome to Clinical Medicine with Dr. T. So guys, today I just want us to have a discussion. Discussion? Okay. What I want to share with you guys is, during medical school, especially the clinical years, you're gonna have your seniors want you to present. They will ask you, have you presented? When are you gonna present? When are you gonna have you presented? Guys, when are you presenting? So this thing of presenting patient presentation, they will ask you up until you leave medical school. When you go to internship, it doesn't get better. You still present. Do you guys know that even medical officers, they present to their seniors? Even registrars, they present to their seniors. Even consultants, they still present to other consultants. They also present to the management of the hospital. So presenting, I know when you are in medical school, you always think that presenting, it's seniors wanting to just get at you, to make you, to expose you, just to grill you for no reason, just to be hard on you. Guys, it's not about that. I'll tell you why presenting patients is important. It's a skill, first of all. It's a skill. And it's not a skill that you pick up from a textbook. It's not a skill that you pick up from sitting in the library and reading a book. It doesn't. And it's not a skill that you learn now and you are done. As you go, you pick up, you become better at it as you go. And the sad thing about it is that you can go and present, you can rotate in internal medicine, for instance. You present there and they correct you about presenting and you feel like, now I got this. You go to surgery. Your first presentation, they grill you there, they tell you that you don't know how to present, you don't know what you're talking about. Have you ever presented? You don't know how to present. And then you ask yourself, why? Because I was doing so well in internal medicine. The thing is this: patient presentation is dependent on where are you rotating. The manner or the way in which you take history, the way in which you organize your history, the way in which you present depends where are you rotating. When you're presenting an orthopedic patient, there is no way you're going to present as if you're presenting a pediatric patient, because the way in which the information is organized and the way in which you ask questions is different depending on where you are. For an example, when you are in peds, you cannot present a patient in peds without telling them about immunization status, without telling them about the birth history, about the feeding history, about the caregiver, who is the caregiver of this baby. Those things, I'm just making an example. But this information is useless when you go to orthopedics. They don't care if the child is immunized or not. They don't care. They might care about who takes care of the baby, but they don't care the birth history of this baby. What they want is, they want their history is relevant to them. And you cannot take this way of presenting and then you go and present in the same way in internal medicine. Like you use the same information, the same structure that you use when you present a pediatric case or a pediatric patient, and then you use it in internal medicine. In internal medicine, they don't care about the birth history. They don't care about the immunization history in internal medicine. So what I'm trying to say is, presenting, it depends where you are. It depends what case you have. For a gynecologist, LLMP is very important. But for a pediatric case, is it really, really important? Even in ortho, do they really care about the LLMP? Guys, when you are in orthopedics, for instance, They don't care that the patient that they have is a graph 6 or a graph 9. For them, that's not relevant. The thing is this: you must know what information to start with depending where you are. You must know how to structure your history. For instance, if you are in internal medicine and then you present a patient and then you start talking about surgical history, you nail the surgical history to detail, they will stop you, and because they want to know about internal medicine related stuff first before you can talk about the other things, about the past surgical history, about the past medical. What I'm saying is, when you're in internal medicine, the important information that takes priority is comorbidities, the past medical history. But when you are in surgery, the information that takes priority is the past surgical history. I hope you get what I'm trying to say, guys. Otherwise, when you present an orthopedic case as if you are in psychiatry, they will be mad at you. Like, for instance, in psychiatry, you cannot finish presenting a patient without talking about the MSE, meaning the mental state exam. The mental state exam. You cannot finish. And for the psychiatrist, they don't care about the heart. They don't really care about that because they can always refer those patients. They don't care about that swollen limb. They can always refer that patient. For them, mental state examination is golden to them. The MSE is golden to them, and as a result, it's a very vital tool for them. It's a very vital tool for them. So, guys, that's the first part. That's the first thing that I wanted to say. The second reason why we have to present is because presenting is a tool we use to communicate vital, crucial, life-changing information to the next person, to the person who's listening to us. So the reason why they fuss about presenting during medical training is because they don't want us not to be able to communicate this information thoroughly and effectively. Because the information, when you present a patient to the next person, it's because they want to manage the patient, or they want to help you to manage the patient, investigate the patient. So the information that you give them becomes very important, because they depend on that information to decide what are we going to do about this patient. Like, for instance, if you are here, you want to refer a patient to the next hospital, which is like 5 hours away or 2 hours away. So when you call the person on call, the information that you give them will make them to decide, doc, it's going to make them to decide, are they going to accept your patient now? Are they going to ask you to send that patient immediately? Or are they going to say you can send the patient after 5 hours? Or are they going to say send the patient tomorrow? Or are they going to say send the patient next week or next year? It depends on the information that you give them. So if you're not effective in presenting that patient might die on your hands. Worst case scenario. Or that patient might even complicate on your hands, because you as a doctor, you are not able to communicate the information to the next, the information about your patient to the next person. That's why presenting is so important. That's why they can even fail you during clinical rotations, because you don't know how to present. It's because that skill is so important that it will save someone's life. It will save. Guys, it's so nice to call a doctor in another hospital, and then they just say, doc, send that patient. After presenting, they just say, doc, send that patient, because it means you have done your part. It means you have presented that patient well. You don't have to make up stories. You must be able to take a good history, do a good physical examination, and then be able to tell this story to this person and say, doc, I'm having this patient, it's like this. I'm worried about this. Because now you have presented the patient well. They don't have questions. They just have to say, okay, doc, no, keep that patient, do this test, give this medication, and then review the patient again in 4 hours. Oh, doc, no, send that patient to the clinic. So it's because you are able to communicate the information. It's about communicating the information about your patient. That's what patient presentation is about. That's why it carries so much marks during clinical years, because like I always say that clinical rotations they are testing our clinical judgment, our clinical reasoning, and unfortunately patient presentation is part of that. So can we reason well? Can we communicate vital information? That's why sometimes, the consultants, not even sometimes, that's why a consultant who's listening to you presenting, they get mad at you when you are just making a mess of your presentation, because they know that in the future there's going to be someone who's going to die because you couldn't present that patient. There's going to be someone who's going to complicate because you couldn't present your patient. So guys, with all these words, all I want to say is, please take patient presentation serious. When there's a chance to present, jump at it. Yes, I know when you present during ward rounds, you present in the morning meetings, it helps you so that when you present during examinations, you get good marks, because they will correct you before you can go to the exams. That's good, that's beautiful, it's nice, that's what we want to pass. But the main important thing is to know how to present when you leave medical school, because you are going to present. As an intern, you're going to present to your medical officers, you're going to present to your registrars, you're going to present to your consultant, and they want you to know how to present. You see? So guys, enjoy presenting. It's a skill. You cannot go to hospital for 1 week and all of a sudden you know how to present. No, it's a skill that you pick up as you go, as you rotate, you go through different departments, you start to appreciate and learn. This kind of information is not important. It's not important when I present. I must discard it. Oh, actually that one is very important, I must keep it. So that's what happens. And also when they start asking you questions as you present, you begin to know what, oh, I missed that one, and then that's how and then the next time you present, you are able now to put everything together, the questions that you were given, that were made known to you, you pick them together and then you move forward. So that's what presentation is all about, guys. I hope that helped. Thank you so much for your support. Thank you so much. Bye.